Oh, hey guys, it's me, Dr. Yusuf. Uh, really hate this mask. Guess what? This is what we need to do, guys. We need to start testing for the COVID-19. So in order to do so, we can take a blood sample or just a simple finger stick and now run the COVID-19 antibody test. It's an IgG, IgM antibody test. Essentially, this test is used to tell you if you're active with the virus or if you've had the symptoms and it's been 14 days and now that you have either a little bit of immunity or you have the antibodies to fight it off. The following test basically explains this instructions on how to test for the COVID-19. It is a explanation of what essentially the coronavirus family is, what are the common signs and symptoms. This specific test has explanations of when you should test for it. The estimated period is going to be 14 days. We would like to confirm cases with the COVID-19 to make sure that either you have some immunity. The following is an explanation of if you have fever, shortness of breath, cough, or runny nose, you may need to simply go to the local hospital to protect yourself and to also protect those around you. The following are the options that you can have to test. The last one, which is the host antibody test, is the one that we are using in our office. A patient was kind enough who tested positive for the coronavirus and has been 14 days out, asked for us to check his blood and see if he was had the antibodies. So we took 2 little pieces of blood and placed them on the dish as so on the IgG and IgM section. It took a few minutes, and then the IgM, as you can see, did not show positive, meaning that the patient was no longer infective, but the other side, the IgG, was positive, showing that he had immunity. To test you for the COVID-19. Whew, this mask. So hopefully, finally, you can take off your mask, and by testing yourself, and the way we're going to do that is with a blood test in the office. So you come in and we'll do something called a COVID-19 serology IgG test. This specialized test is only done after you've had the symptoms. So if you have had a cough, congestion, a runny nose, fever, you're just not sure if you've had it or not, and it's been 14 days and you're out of quarantine, come on in, we'll check your blood, we'll let you know if you had it or not. One thing it'll tell you is that if you're not active with it. Number 2, you'll be able to know that if you've had built up a little bit of immunity, so that your exposure might be less powerful. So right now we're doing, there's only a special number of tests that are available because of the limited, of course, quantities, and only a few laboratories have emergency accessibility to these tests. So unfortunately, not everyone has an ability to run this test without the FDA's emergency approval. Right now, the FDA hasn't fully approved them, but right now we're using them as best as we can under the circumstances. We have to find some kind of testing to do. So if you're thinking of visiting grandma and grandpa, you're thinking of visiting a loved one, you're thinking of going back to work and you're just not sure if you want, if you've gotten exposure, if you want to be tested, come on in. We're going to check you for the COVID-19 IgG serology test, meaning that it's not an active condition, and if you have an active condition, please go to the hospital or an urgent care center that is going to take you for testing and is prepared for that. We are going to test you for post-exposure, meaning 14 days after your symptoms are gone.